Hi, I'm Dr. Seher Oakhead, and I thought I'd try something new this week and send you a video blog. So let me know what you think after, and if you want me to do some more, if I should just stick to writing, you can let me know in the comments or send me a reply after. So I thought I'd talk to you today about something that people ask me about often, which is the different types of hormones that you can use, as in body identical, bioidentical, synthetic. So I thought I'd give you a bit of an overview on this, just to see if it's helpful to make sense on things, because there's lots of conflicting information out there. So first of all, a lot of people still worry that the hormones they're going to get from the GP are made from horse's urine. And that's a really old school way of prescribing. You can still get that medication available, but it's not really widely used. Like most of the estrogens, especially used that the GPs prescribe, even in the oral tablets, are more of the body identical type. So you're probably wondering, what does this mean, body identical? So what it means is that these medications, tablets or gels like Estrogel or Sandrina, which are both estrogen gels, or the patches you can get, they are made by a drug company, but the actual hormone in the tablet, patch or gel has the same molecular structure, the same chemical structure as the hormones your own body was making. And for this reason, your body can metabolize it better. So that's obviously really good news. And I use these in my patients and they work really well in a lot of cases. Now, with progesterone, the only body identical progesterone available at the moment, i.e. a progesterone with the same molecular structure that your own body would have been making, made by a drug company, is utrogestan. That works really well as well in a lot of people. Now then comes in the bioidentical hormones. Oh, sorry, before I go on to that, so like I said, a lot of the estrogens are fine in your normal HRTs, your Femistans and your Cleovances and your Elastuet and things like that. But often they're combined with a non-body identical progestin. I don't call that progesterone, I call that progestin because it's synthetic. It does not have the same chemical structure as the progesterone and utrogestan or that your body makes. And it just doesn't process very well in the body. So we've also seen that it can increase cancer risks. So I try and stay away from that with my patients and stick to the utrogestan or a different sort of progesterone, which we'll come on to in a moment. So that's the main differences between body identical, the more standard HRT, which is normally a good estrogen, but combined with synthetic progestin. And then we come on to bioidentical hormones. So bioidentical hormones and body identical hormones are very similar because the hormones involved have the same chemical structure as what your own body was making and your body can metabolize it well. The difference is a lot of the bioidentical hormones aren't made by a drug company. They're made by manufacturing laboratories. And there are three main ones that I use in the UK. One's called the Specialist Pharmacy, one's called Roseway Laboratories, and one's called Customized for You. They're all excellent. I tend to use Roseway Laboratories a bit more than the other two, but I've got no issue with any of them. So basically, these laboratories, they still go through regular checks. They're authorized by the General Pharmaceutical Council. You know, there's not someone in their bedroom mixing up hormones. They have regulations, because one of the big issues that a lot of conventional doctors have is are these actually regulated and checked? Well, they are. They have safety procedures in check. And for example, Customized for You, their parent company is a big company in the USA that produce bioidentical hormones, and they follow the same rules and regulations as them, and they speak to them if there are any issues and things like that. Roseway Laboratories, I know, is inspected also by the General Pharmaceutical Council. So there's lots of regulations in place. These aren't just people. Also they're done by pharmacists and lab technicians and people with qualifications, not just some random making something in their bedroom, you know, a Breaking Bad sort of chemistry experiment. So I trust these laboratories. And if I've ever had an issue with a particular cream or dosage or something, they've been really responsive, and I can see they've got measures in place to look at issues as well and test the hormones in a thorough way. So I feel reassured by that. And so you might go, well, why would you use a bioidentical hormone over a body identical hormone? Well, in my prescribing, it's actually 50-50. 50% of people I see take the more estrogel, utrogestan route, and they feel really great on that. There's obviously a cost implication as well, because these are made by drug companies, not custom made, the pricing can be slightly better. So I want my patients at the best price. I want them to use something that works really well for them. But I also have a lot of patients who've tried those medications and they haven't worked for them. The dosing is too high. They can't get on with the consistency of the gel. They need a different sort of formulation. And I feel really happy that I can offer my patients that. I'm not just like, sorry, you didn't get on with the estrogel and the utrogestan, so that's it for you. I can also offer them a lower dose, a more customized dose, a different base of the cream. There are also other formulations available, like sublingual tablets, lozenges that dissolve in between the gum and the top lip. And of course, one of the reasons I use a lot of customized medications, as in the bioidentical, is for testosterone, because there is not a drug company in the UK that makes a testosterone in the dosage for a woman. Most of the dosages available are for men, around 20 milligram to 50 milligram. Well, most women I see only need to take about 1 milligram a day. So if I'm giving them 20 milligram, that's massively higher. It's almost 7 times higher than what they need. And it's really hard to try and figure out the lower dose. Like, am I going to use a syringe, or, should I just put a little dab on and hope for the best, So I'd rather give people the dosage that I know is going to work better for them as a woman. So that's one of the big reasons I use custom-made testosterone in particular. But also for all the other reasons I said. I want to give people a choice. I feel confident using these sort of hormones because I've been doing it for so long and I've seen thousands of patients. And I also want to just give people a choice, and not just go, oh, this is all that's available, that's it for you. I'm really into personalizing the care for my patients, but also working within what works for best for them. I don't get any sort of financial incentive for using one lab over the other, or using a body identical over a bioidentical, or vice versa. All I want is what works best for the person in front of me. So I hope that's clarified some of the issues around bio and body identical hormones, and also the other hormones you can get from your GP. If you found this helpful, let me know. If you'd like more videos, let me know. If you'd like more content on specific hormones, also let me know. I'm here to serve you. Speak to you soon. Bye.